Good morning or good early morning, depending on where you're joining us from today. Thank you so much for being here. We're so appreciative of your time and your support this morning, and we have an amazing program. So as we're giving folks a chance to get logged in, I'm going to run over a couple of housekeeping items and introduce myself and others. So I'll leave just sharing. I'm your host today, Candace Farrell. I'm our Director of Network Communications here at United Way Worldwide. And while you're joining us, do feel free to say hello in the chat. We will have that enabled for now. And then once our program starts, we'll go ahead and disable that so that we can really focus on the conversation. And as I'm hosting today's town hall, I also have some other members of our events team with us that will help things run smoothly. So if you do need any assistance, just either pop into the chat and you can let us know how things are going. We are recording today's session, so after the program, we will make that link available to folks. We'll send out a follow-up email to make sure that you have access to that. And you'll also notice that we have our captions set as a default. So if you don't enjoy seeing captions at the bottom of your screen, go ahead and just scroll down and you can disable that function and your closed captioning will go away at that point. So as I mentioned already, we have an incredible program lined up. We have a number of members of Congress that are going to be with us today who also share United Way's commitment to ending hunger and food insecurity in our communities, including a Q&A portion with Representative Jim McGovern. So we're so thankful for his time and insights this morning. After that, you will also hear from United Way folks and 211 leaders who will share how 211 is working within communities to reduce disparities in hunger and to help promote health equity as a part of a panel discussion. We will also have time for questions. So when we start the Q&A portion, we do ask that you navigate again to the bottom of your screen and look for that Q&A feature. Once you see that, you can select that and you can pop your question in right there, and that will enable us to field your questions. So thanks for your patience on those updates. And now I have the honor of turning the program over to our President and CEO of United Way Worldwide, Angela Williams.
Thank you so much, Candace, and hello to everyone. We're so pleased to have you join us today as we focus in on ending hunger in the U.S. by 2030. United Way envisions a world where all individuals and families thrive and reach their full potential. We work with private, public, and nonprofit partners to tailor solutions in order to improve nutrition, food access, health, education, and economic stability in 95% of U.S. communities. Last fall, I had the opportunity to attend the first White House conference on hunger, nutrition, and health in over 50 years. I was honored to be surrounded by so many health and nutrition advocates and policymakers, all dedicated to reducing hunger in the United States. Their diverse backgrounds and life experiences, as well as their commitments to solving this issue, was inspiring. The impact from the initial conference back in 1969 was felt in the years that followed it, as it greatly influenced our country's food policy agenda. It helped establish some of our most effective food and nutrition programs, such as school lunches, the Special Supplemental Nutrition Program for Women, Infant, and Children, known as WIC, and changes to how we label foods. The bipartisan attendees at this conference aimed to build off all that we've accomplished since 1969 and end hunger in the United States by 2030. That's not that far off. A commitment that United Way is proud to join in. Many of our neighbors struggle with hunger and diet-related diseases like heart disease and diabetes. While the impact of hunger affects all Americans, it disproportionately impacts underserved communities, communities of color, low-income families, and rural Americans. United Way networks around the country know how hunger and the lack of affordable and accessible nutritious food impacts our communities. Last year, 211 which is supported by United Ways across the US, helped 2.7 million Americans reduce hunger and helped deliver 6.7 million meals through the Ride United program. Last mile delivery. These calls routed families and these calls to our 211 call centers routed families and individuals to food banks and other meal programs, as well as delivered nutritious meals to those in need. The United Way is committed to doing its part. And we want to work with others to hit this achievement, this incredible milestone for 2030. In addition to the programs I mentioned, United Way recognizes the value and responsibility of civic engagement. By engaging in policy and advocacy work at the local level, state and regional levels, and national as well, we're able to see long-term sustainable impact across communities. I'm so pleased to be able today to introduce to you our new Vice President of Public Policy, Josh Dixon, who has been with us for just over a week now and has hit the ground running. Josh will be working with our local United Ways across the country on how we can align our efforts and rally around policy solutions that will have a positive impact on our communities. So again, welcome to you all today to this session, and welcome to Josh Dixon, our newest member of the United Way Worldwide team. Josh, turning it over to you.
Thank you so much, Angela. I'm really thrilled to be joining United Way. Very excited to be a part of today's conversation and just really appreciate the warm welcome that I've already received from you and so many folks here at Worldwide and across the network. I have had the pleasure of working with United Ways in a variety of roles from outside the organization for almost 10 years now. And I've also had the honor of collaborating with many folks joining today and many across the network on things like the child tax credit, on things like housing assistance, hunger and nutrition, and health issues in my most recent role at the White House. It's great to be with all of you as an official part of the United Way team now. And I really look forward to getting to know folks across the network and identifying high impact ways that we can collaborate and that we can also support the important work that you all are doing at the local level. Before we hear from our congressional leaders, I just want to reiterate what Angela was saying about United Way's commitment to reducing hunger and food insecurity, and just call on all of us to be thinking about how we can work together to advocate for more nutritious, affordable, and available food options. As we know, food security provides a pathway to financial security and opportunity. The congressional leaders joining us today have shown their commitment to ending hunger and improving nutrition in the United States. We are really honored to have remarks from a bipartisan group of members of Congress across the House and Senate, including Senator Mike Braun from Indiana, who last Congress served as the lead Republican on the Senate Agriculture Subcommittee on Food and Nutrition. We're also going to be joined by Senator Roger Marshall, MD from Kansas, who has served on the Senate Agriculture Committee, as well as the Senate Health, Education, Labor, and Pensions Committee. And we're also going to be joined by Chairman G.T. Thompson, a Republican from Pennsylvania. Congressman Thompson took over as chair of the House Agriculture Committee earlier this month. These leaders from the House and Senate will have a major role in the upcoming reauthorization of the Farm Bill, which has authorization over many of our food and nutrition programs. On top of that, we're really thrilled to have Congressman Jim McGovern of Massachusetts joining us for remarks and Q&A. Congressman McGovern is the lead Democrat on the House Rules Committee and a senior member of the House Agriculture Committee. So we're going to come to him in a little bit. And Congressman McGovern, along with Senators Braun, Booker, and the late Congresswoman Jackie Walorski, were instrumental in securing last year's White House conference. After our conversations with Angela and Congressman McGovern, United Way leaders will be sharing how they use 211 in efforts to reduce disparities in hunger and promote health equity as part of a panel discussion. So first, we're going to hear from Senator Mike Braun, who was able to send us a pre-recorded message. So with that, we're going to go right to the message from Senator Braun.
Hello, Senator Braun here. Hey, I know there are United Ways all across our state that deal with food insecurity and hunger all the time. Kudos to your effort. It's so important. I want to start also by acknowledging Congresswoman Jackie Walorski, a good friend of mine. Wish she were still here. She is always one that would take on big issues, wrestle with them, and hunger, nutrition, and health would certainly be in that category. We work together with colleagues across the aisle in that White House commission that was put together especially for that. In honor of her legacy, we're going to keep working towards those goals. Looking forward to the Farm Bill, we should take a lesson from that conference. Ending hunger in America ought to be really important to what we put together there as well. We need to be honest about the state of nutrition in America and create effective reforms, ideally not driven always from the federal level. Most things get done most effectively, most efficiently when it's more of a bottom-up approach. So whatever we do at the federal level, we need to make sure we're ensuring that there's grassroots participation. State and local governments are going to have a role in it as well. Finally, United Way, organizations like yours that have always put this at the forefront, you're going to be in the trenches making this work. I'm proud that I'm working on this from DC, and we'll keep pushing forward.
Huge thanks to Senator Braun for joining us via pre-recorded remarks today. And now we're going to turn it over to another video from Congressman G.T. Thompson.
Good morning. I'm G.T. Thompson, Chairman of the House Committee on Agriculture. My thanks to the United Way for inviting me to this virtual town hall. And I wish I could join you live, and I look forward to a time when we can meet in person. As chairman, it is my responsibility to set an agenda for the next 2 years, including how to produce a farm bill. My colleagues and I will be laser focused through a rigorous hearing schedule, field listening sessions, and aggressive oversight initiatives. To produce an impactful farm bill, one that reflects the needs and values of our communities across the nation, we must hear from Secretary Vilsack, other relevant officials, and stakeholders like United Way to discuss executive actions, spending, programmatic operations, and the future of agriculture and nutrition. Related to nutrition, many perceive SNAP to be on autopilot and unable to be disrupted. However, I think there can be bipartisan agreement on issues related to nutrition, health, and well-being. For example, we should easily be able to find common ground on ensuring families in need have access to effective nutrition education, or that families have access to better employment-related services. Now, that being said, I've long spoke about my 4 guiding principles that will resonate in every conversation I have about nutrition. First, serving families with innovation and flexibility, from skimming to accessing food, technology, and innovation could ease bottlenecks in the system. Second, pursuing independence through employment and career and technical education. We're on the other side of a pandemic and in the midst of a shifting labor landscape, so we should build on SNAP employment and training to improve outcomes. Third, restoring and maintaining program integrity and the department's accountability to the taxpayer. Title IV of the Farm Bill is expected to cost the taxpayer more than $1.1 trillion over the next 10 years, and integrity matters. And last, but certainly not least, enhancing nutrition education and promoting healthier eating habits. Families are afflicted with diet-related diseases at an alarming rate. So how do we promote healthy eating in a way that shows tangible outcomes, like improved health metrics or less reliance on prescription drugs? Now, I sincerely look forward to engaging with you all on these principles and learning more about what is working, what is not, and where can we all do better. Thank you for your time, attention, and commitment to bettering the lives of families in need. God bless.
Big thanks to Congressman Thompson for his remarks and for his commitment to these issues. Now, I'm really excited to turn it over to our first live guest today. Senator Roger Marshall is joining us. Senator Marshall also goes by Doc Marshall because he does have a long career serving his community in the medical field. He brings a wealth of experience, a wealth of insight into this issue in particular. We're so thrilled to have him here and grateful on behalf of all United Ways for his leadership on these issues. Senator Marshall, over to you.
Well, good morning, Josh, and I'm proud to join you today as we all fight for a hunger-free America by the year 2030. As a lifelong Kansan myself, I feel a special affinity to help end hunger around the world and in our own country. It was 1953, 70 years ago, that a Kansan in Cheyenne County had the concept of using food for peace. They launched that program when President Eisenhower signed that bill in 1954, and now it's morphed into the USAID program. You know, personally, on a personal basis, in my own home community, I work with United Way every year. We're so proud to give to United Way, so proud of all the work United Way did in many areas, but including fighting hunger. My own wife and kids volunteered at a food bank, our church, for 1 month every Sunday. We did the Meals on Wheels program. So I had a great idea of actually what was working in the real world. And then as an obstetrician, believe it or not, I delivered over 5,000 babies. And I learned very early on how important nutrition was, actually even prior to conception. Was so proud to work with the WIC program and the great job that those folks do as well. So when I came to Congress and now on the Senate side, again, I think I had this concept of what works and what doesn't work. So I'll be proud to work with United Way. I'll be proud to work on this year's Farm Bill. And so many opportunities out there. I would leave you all with this. You know, as a physician, we can't focus just on the quantity of the food, but we also need to focus on the quality of the food. Across this nation, we have an epidemic of type 2 diabetes and obesity. So we need to work on ways where we can get more fresh fruits and vegetables in front of people. I've seen the Double Bucks campaign work, you know, from that standpoint with the SNAP program. We've had the food to homes program with farmers where they bring food and we're able to use SNAP dollars for some of those fresh farmers markets as well. We need to figure out ways to make protein less expensive and more available as well. So that'll be my focus, not just ending hunger, but also ending this diabetic epidemic. I'm proud to be here today and look forward to working with United Way on this year's Farm Bill.
Thank you, Senator Marshall. We are so thrilled to have you here today. We're so grateful for your leadership for the folks of Kansas and for our country. We're looking forward to working with you on the Farm Bill and many other issues. And go Chiefs this weekend. Yeah. Love the tie. Yeah. Thanks so much for being with us today. We really appreciate it. Next, we're really thrilled to hear from our next guest, who's also joining us live, Congressman Jim McGovern from Massachusetts. Congressman McGovern, we have heard some great things about you from our friends in Massachusetts, including your dear friend Tim Garvin and the team at United Way of Central Massachusetts, who are celebrating 103 years of service. And so we're thrilled to have you here, and I'm going to turn over to you to provide remarks.
Well, thank you, Josh, for the kind introduction, and thank you, Angela, and everybody at the United Way for inviting me here today. I'm also thrilled to see that my dear friend, who you just mentioned, an incredible community champion, Tim Garvin, is on this call as well. Tim's he's tireless in his efforts to improve the lives of those in Central Massachusetts, and just a great friend. Look, I appreciate the remarks of my colleagues, Chairman Thompson, Senators Braun and Marshall. I was honored to work with Senators Braun and Senator Booker, as well as my good friend, the late Congresswoman Jackie Walorski, to bring about the White House Conference on Hunger and Nutrition and Health last September. This conference brought together agencies from across the federal government, experts, and people with lived experience of hunger. And out of that conference came an ambitious but achievable roadmap to end hunger and reduce diet-related diseases by 2030. And the national strategy calls for a whole of society response to end hunger. Now, we don't need to reinvent the wheel to end hunger. You're doing it in our communities already. We need to connect the dots and make sure that the resources are in place to support your work. There's no question that there's more to be done, but we're off to a good start. There is finally momentum at a national level behind efforts to end hunger. And at the White House conference, President Biden made clear that it is a priority of the federal government to end hunger this decade. and we must keep aggressively implementing the national strategy. Now, during the last farm bill, I said that I wouldn't vote for any farm bill that made hunger worse. I still believe that, but in the aftermath of the conference, we need to add to that. We need to make sure that we have a farm bill that also builds upon the bold commitments laid out in the national strategy. We have a real opportunity to think big and take transformative action to end hunger in this country once and for all. And we can't squander this important opportunity. Look, I'd be lying to all of you if I said I wasn't concerned about some of the comments from some of my colleagues on the other side of the aisle, especially in the context of the debt ceiling debate, who have indicated that programs like SNAP could be on the chopping block. And I worry about cuts in SNAP or complicating SNAP or limiting eligibility of SNAP for people who currently have it that might move forward in any farm bill. So look, I'm going to fight tooth and nail to make sure that that doesn't happen. And while Congress works out the farm bill process, my message to all of you is keep up the good work and don't wait for Congress. We move too damn slow here. Think big and bold on how you can work towards implementing the goals laid out in the national strategy. So the work that you are all doing every day in and day out in your local communities is invaluable in fighting hunger and supporting individuals and families going through a tough time. And I am proud to stand with you. And again, I thank you for all the incredible work that you're doing all across the country. And with that, I yield back my time.
Thank you, Congressman. And we're going to take a couple questions now. So if folks would like to use the Q&A function, you can lock up a question for the Congressman or for Angela. We're going to do our best to get to what we can. Congressman, I really appreciate you touching on the national strategy, because that is something that we're going to talk a little bit about later in this call, and in particular about how local United Ways can be involved in taking action aligned with that. So really, really appreciate that, and appreciate your leadership on that strategy as well. I know that you have been working in a stalwart way on that. So we're so grateful for that. So our first question actually does come from our dear friend Tim in Massachusetts. Tim says, the brilliance of the United Way is that we are a network of more than 1,000 entities across America. Each is authentically engaged in our respective communities, engaged with people with lived experience, businesses, foundations, nonprofit partners, community leaders, volunteers, and contributors. Many of us have existing programs and have similarities and differences. Tim's question is, in addition to continuing our existing programs, what can we all do together starting today that will accelerate and deepen our work to end hunger and bring food security to and for all?
Well, a couple of things. So the United Way, what I think is really special about the United Way is that you just don't support organizations. You help build collaborations and coalitions to solve problems. And so when I said in my opening remarks, we don't need to reinvent the wheel, I was thinking about some of the stuff that you're already doing. We need to figure out ways to amplify that good work and to make sure that at the federal and state level, we're wind at your back. The other thing is it is important to use your voice based on the experiences you have in your individual communities to educate members of Congress and to help make sure that people, as we go into a farm bill, know what the reality is. One of my biggest kind of challenges here, quite frankly, is sometimes the narrative that is provided to justify cuts in SNAP or in other nutrition programs does not represent the reality. And, you know, we all want to make sure that people can live their life to their full potential, but let's also understand that the majority of people on SNAP right now who are able to work do work. Work doesn't pay enough. So this program is vital for not just people who do not have work, but for people who are working. But it is important that you help establish the truthful record and reality about what is happening, and tell and amplify those stories. I'll just close with this. I mean, we're inundated with facts and figures and statistics all the time. And I sometimes worry that we have lost our human ability to feel what they mean. You know, tell the stories, tell the success stories, tell us about the hardships that you encounter every single day. And I think those human stories can help maybe move people who may not have always been with us on these issues.
Thank you, Congressman. Really appreciate that. Our next question is, we have some curiosity around some of the things that are some of the reforms currently being considered to combat hunger, specifically in rural and low-income parts of the United States.
Well, look, I mean, hunger is a problem everywhere, and it's particularly complicated and challenging in rural areas where transportation is an issue, and sometimes people do not have access to nutritious food. So there are all kinds of models out there that I think we need to, again, amplify. I mean, everything from mobile markets to helping to expanding universal free school meals for every child in this country. I'm urging the Secretary of Agriculture to expand community eligibility so more school meals will be covered with federal money. My hope is then we can take that and go to the states and say, okay, now you do the rest. Pass laws that guarantee every child, no matter where they are, a free, nutritious breakfast and lunch. And in some places where, it may be even dinner. But the bottom line is, we need to be thinking in those terms. We also need to work with our farmers more directly. I mean, our farmers are the ones who grow and produce all this great food. We need to make sure that, that they're part of this discussion. We need to deal with the issue of food waste. 40% of what we grow and produce in this country, we waste. We need to better connect the dots. We just passed some legislation in the House, which I think will alleviate some of the difficulty. But all those things, I think are important. But again, and I'll just end with this, as I sound like a broken record on this, but I am a big believer that also part of these discussions have to be people with lived experiences. I mean, I have lots of ideas. Some of them seem good on paper, but when I go and I talk to people who are actually dealing with hunger and nutrition insecurity, they point out all the flaws in some of these great ideas. We need to listen to people who we're trying to provide some help to. And we also need to do this in a way that maintains dignity. The food we provide people, the benefits we provide people to get food should be the same kind of food that all of us would want to have on our dinner table. There has to be dignity in this. This is not charity. We're doing this because it's not only the right thing to do morally, but I'm going to tell you, and this firsthand, hunger and nutrition insecurity costs us a boatload of money. Kids who go to school hungry don't learn. Workers who go to work hungry are less productive. We have tons of avoidable healthcare costs that pile up. So, we need to do this because morally it's the right thing to do. We need to do this because we also can save some money here too. So whether you're liberal, conservative, we have a way for you to fit into this this cause. And I hope that you will use your voices to persuade people to really. This is the year. We have an administration that has made this a priority. We have 2 years, hopefully longer, but we have 2 years right now. We have to look at it as an opportunity to move things in a big way.
Thank you, Congressman. Really appreciate that. Appreciate you stressing the sense of urgency of right now, and also appreciate you lifting up the importance of folks with firsthand experience being a part of the solution, which I know you really championed with the conference itself, as well as the national strategy. So we're deeply, deeply grateful for that. I saw a couple questions in the chat from Carla and from CJ and from Carol around resources and follow-up and other things like that. We're going to make sure to follow up with folks around next steps on our end for policy advocacy support. We're here, want to work with all of our locals on that. So be on the lookout for that. That's coming. More on that front. Our final question that I would just want to put out there is for Angela. Angela, food insecurity is one of the many issues facing communities that United Way serves, as we all know. What message would you share with our audience members who are wrestling with how to ensure this isn't an issue burdening their neighbors and their communities?
Well, first, thanks, Josh, for the question. First thing I do want to just acknowledge and reiterate again that Congressman McGovern said is the fact that hunger has a cascading effect. And if an individual is hungry, then it impacts so much of their daily lives. And so we need to recognize that. And that's why I am so thankful that the White House conference took place, that Congressman McGovern and so many other champions were responsible for pulling this together and having us as Americans declare that we should have a hunger-free America by 2030. And that is a goal that we should be able to achieve with this wonderful nation that we are privileged to live in. We have the ability to work across aisles and across sectors toward this shared vision. And so I want to thank you, Congressman McGovern, because you have been an incredible champion. Thank you for your presence today. I want to thank Chairman Thompson and Senator Braun for participating in today's program as well. And coming back to Congressman McGovern, we were so pleased to have you speak to our United Way policy leaders from across the country last year. That was my first opportunity to get to meet you in person, and it was my honor and privilege to do so. I think it just shows again the necessity for us to build on relationships. And Congressman McGovern, you really hammered that in about the human connectivity, and that we have to come together, and it's about working alongside each other, shoulder to shoulder, understanding that we have this shared vision, also understanding that we have the ability to achieve this goal. And so I'm so glad that United Way as a system is working together alongside you and others to have these critical conversations, that my colleagues locally are developing deep and authentic understanding of what's happening to their neighbors in local community. I'm so grateful for the fact that United Way Worldwide, our goal is to really create more resilient and equitable communities in the United States. So again, thank you, Congressman McGovern, for your time today and for your continued partnership. And I look forward to having even more of these kinds of sessions and opportunities to champion this goal. And of course, I look forward to having a huge celebration come 2030 to say that we have solved for hunger in America. Thank you.
Thank you.
Thank you, Angela. Thank you, Congressman. Just appreciate both of you and your leadership. We're so grateful and very excited to continue the work together. Congressman, we know you have to jump off to something, but again, just thank you so much for being with us today.
No, and let me thank you again. Thank you for your passion. Thank you for your dedication. Thank you for making a difference. Thank you all for being born. I'm so proud to work with you, and we're gonna achieve big things in the next couple of years. So all the best.
Thank you, Congressman. We look forward to that and to doing that together. Also want to just thank everyone else who was able to join us today from the House and Senate, Senators Braun and Marshall, Congressman Thompson, and just for their commitment to ensuring that no person goes hungry. We look forward to working together and to seeing all of them on the Hill soon, hopefully with those of you who are joining us today and everyone who's tuning into the recording. So with that, I'm going to turn it back to Candace.
Yes, thank you so much. Again, echoing all of the sentiments already, just so pleased and appreciative of the participation and, just the remarks about every data point is connected to a real person with the intrinsic value, how we really want to support that. And it's going to take all of us. So speaking of it taking all of us, we're going to review our 211 program, which is an incredible resource in communities around the U.S. And we have some really dedicated and passionate professionals that really champion this program and do incredible work in their communities. And I have the pleasure of introducing them. So we're going to have a moment now to chat with our panelist, Sarah Berthelot. She's the president and CEO of Louisiana Association of United Ways. We have Lori George. She's president and CEO of United Ways of Palm Beach County. And then we have Josh Patterson, who is our 211 senior director here at United Way Worldwide. And these folks are just so talented and have so many important insights to share. Sarah, if it's okay with you, I'd love to begin with you and just get some feedback on, as the United Way leader in your community and in the country, can you share how you feel the 211 network uses its people, partnerships, and technology to provide the free and confidential resources for just a wide range of social services, everything from food, housing, utility payments, transportation, disaster assistance. You can just share some high points of how you think it is so important and how the program works.
Thank you, Candace, and good morning. It's an honor to be part of this dialogue and honored to speak about 211 this morning. 211 is an unmatched, free, and confidential service that's leveraged by millions of people across North America to meet critical needs. 211 is powered by 240 dedicated nonprofit organizations working in partnership with United Way. Together, our network has responded to 53 million requests during the 3 years between 2019 and 2021, and we're now finalizing our impact reach statistics for the most recent year of 2022. So to explain how 211 works and how we help, to access help, people simply dial 211. It's accessible to 98% of the country. And thanks to the Federal Communications Commission, this easy to remember dialing code was designated to enable community information and referral services as a matter of public interest. With 25 years of service experience, 211 is a trusted source of help and information, and there are some key reasons for this trust, and I'd like to share these reasons with you today as I describe how 211 works and how 211 helps with the issue related to hunger. The first reason is 211 demonstrates a commitment each day to serve people equitably in their moment of need by carefully listening, identifying the underlying problems, and connecting people to available help in their local communities. To show this commitment to all, 211 serves everyone. 211 serves non-English speakers. We serve people with special needs. We serve elderly. We serve parents. We serve kinship caregivers. We serve people that have limited reading skills. We serve tribal communities. And of course, focusing on the topic of hunger today, we serve many families who are hungry and need our help. Last year, as Angela mentioned earlier, 2.7 million families relied on 211 to connect to local food banks, soup kitchens, application sites for SNAP benefits, perhaps disaster SNAP benefits, free summer meals for children, and WIC programs. That's just to name a few. The second reason why 211 is a trusted source of help is we're committed to maintaining accurate and hyperlocal data about programs and services in local communities during times of disaster, during times of sunshine, especially as it relates to sources of food help. To accomplish this end, we foster cross-sector network collaborations with communities and governmental partners alike at all levels. When we provide information to someone, it's critically important to 211 that we're guiding a person in need accurately to solutions and mitigating against any further suffering. We also leverage technology to understand trends and needs, gaps in services, and through 211 and technology and data, America's needs can be brought into focus, including needs related to hunger. Final service trust highlight today, our communities know that 211 is always there. In most places, 211 serves 24 hours a day, 7 days a week, including holidays and even hurricane landfalls. Through these strengths, 211 in partnership with United Way plays an active role in reducing hunger throughout this country. We naturally are working in support of the National Strategy on Hunger, especially as it relates to food, access, and affordability. Thank you again for allowing me to share a little bit about 211, and I look forward to our panel discussion.
Thanks so much for that, Sarah. Very, very helpful. Lori, I'm going to come on over to you now. We know that nationally, more than 49 million Americans struggle with putting nutritious food on the table. And even in Palm Beach, where folks might think it's paradise, communities are not exempt from these challenges. You have somewhere over 200,000 residents that are really struggling. So can you share with us what you and your community are doing to help impact this?
Great, thank you so much. It is an honor to be amongst friends and hear the comments about we create coalitions to solve problems, and to hear Congress say, let us be the wind on your back. We've had a lot of great experiences as we've tackled this problem. About 8 years ago, we went out into our community to determine what the most pressing need was. We went, as a lot of United Ways do, to our 211 and found out what the greatest number of calls were, what they were seeing on a basis. We went deep into our community to hear local voices, even having children spell out for us, we need food, FOOD food. We went to national partners to find out what the data was. And then we went to the Board of County Commission and said, do you want to be our partner in this? And they said, yes, we've been waiting for United Way to take a lead. We need United Way to create this coalition. And that's really how it started. We put up some money, we contracted with the Food Research Action Center, and we put out a bid. We had the University of South Carolina come in and really help us put together a robust plan with 10 tenants in it. It's all available on our website with multiple reports, so we're delighted to share that. But we really did. We tackled childhood hunger, senior hunger, infrastructure. One of the things that was really particularly valuable with the 211 being at the table with us is they were there to help us solve problems in real time during the course of this 8 years. We have this big plan, but then we have steps along the way. And what our community experiences, I know a lot of folks did, is during COVID, we have a big service industry and people were laid off. People that never needed to use a system were calling 211. And our program team said, let's collaborate with 211 and build a food finder map. And so we continue to run that, but it was so awesome. And we were able to talk about it on the television stations. They would show the food finder map. So anybody could go on their phone, their computer, and understand what the qualifications were, the hours were, et cetera, to access that. They continue to populate it. But one last thing I want to share, and then I know we're tight on time, is because of these partnerships, because 211 continues to help us, we can look at the geographies in Palm Beach County, which is a very large county, and see where are these needs. With that, we know where are the food pantries, where are the gaps, and then to take it further, in Palm Beach County, we have a really rich agricultural property out in the Glades area. They produce so many fruits and vegetables, and a lot of it does get wasted, the way the congressman was talking about. And so we were able to access $4 million from our county government, $4 million of ARPA funds. So we had $4 million of private donations. Mackenzie Scott was a big part of that, along with other donations, and leveraged $4 million. And now collaboratively with our entire team, we're putting together a food preservation center and commercial kitchen, which is gonna, it's just a beautiful thing. And it's foods you would eat, I would eat. And then it will get created there, and then it'll go out to the pantries. So people who have limited transportation can go to their local pantries. But in the local pantry, they needed refrigerators and freezers and the proper equipment in order to handle that. So we're doing a massive build out in partnership with the for-profit providers, the nonprofit providers, the faith-based government, and so on. So it's just a really exciting time. But again, I can't underscore how important 211 is as a partner in real time as we walk through this path together.
Tremendous. That is incredible. And that 360 approach is so important. We see that with partnerships and those collaboration points. So Josh, I'd love to pivot over to you here and just draw on your experience as a United Way worldwide leader. Can you help just explain to us how the United Way network supports 211 about that partnership?
Absolutely. Thanks, Candace. I think it really comes down to United Way, really simple. We want to make sure people have access to food. We want to make sure there's food on the table and that hungry people have nutritious, healthy meals accessible to them. So that's the most important thing that United Way is doing, and why we do all these amazing data projects. And we have this really cool phone number and make it accessible like it's been talked about. And that we've got last mile delivery programs. That food security, as it's been mentioned, provides a pathway to financial security and financial stability and economic mobility. And as Angela mentioned, it's got a cascading effect. If we can tackle issues of food and hunger, we start to tackle the root cause of disease, and we become preventers of these problems out there in our community. So we're solving those community problems. So simply put, it's about helping people access food, but those long-term results are what matters. United Way is there, and we invest in these programs and invest in 211 and these food finders and all of this great work in every community, because we bring the best of business philanthropy together. We bring the best of government leadership together, and we couple that with our nonprofit innovation and our nonprofit community partners that we've talked about, and we start to solve those problems. That's what United Way is doing, and that's why it's so important that we invest in these programs.
Thank you so much for that. And we actually have some questions coming in if you all are available to field just a few here. One being someone is looking for a link to the food finder map. Where can folks find that?
Sure, that's on the United Way of Palm Beach County website under hunger is where all these different resources are, and you can see that map there. More than happy. We have an amazing staff that is more than happy to answer questions and be a resource to all of you.
Wonderful, wonderful. We'll go ahead and take another one. And this might be one that, we're talking about providing dignity and high quality of resources, not just giving you what is left over. So we have a comment / question here that says, even with free school meals and food stamps, how are we assuring that food is healthy? Schools are known for processed food with artificial sugars, and people who are using food stamps or programs may be looking for cheaper alternatives, which also tend to be unhealthy. Is there anything you can share about what you've seen with the food pantries and how folks are tackling that issue?
I'll offer some ideas there. So we have the fresh access box where we're trying to work so that people can go to some of these markets and actually use their resources there to pick out what they want. We've also done some innovative programs in the schools where they develop community gardens, things like that, and even take their goods to green markets. So that's been really another positive. We also had a major funder, the Jim Moran Foundation, and with the weekend backpack program, they really said, you know what, we're not going to just give you the basic. They did a whole nutrition analysis on this, and they said, we're going to give you a big increase to make sure that that food is the right food that these kids are taking home. And so I think it's just been really clear on what that is. And then when you're able to communicate about that issue, people are willing to step up.
Excellent. And Josh, I saw your wheels turning if you had something to share.
Right. Those are great examples, Laurie. And I think so many nonprofits are being innovative about how we can ensure that food is nutritious, provided in those backpacks, in those food banks, whether it be client choice. I would also add that many United Ways are leading efforts in their community to make food stamps accessible at farmers markets. So it's a public policy issue to make sure food is accessible in all areas of all communities, and having that nutritious food through food stamps or through the delivery programs. All of those things are making a difference.
Excellent. Very great. All right. Well, with that, I think we're going to wrap up this panel discussion. We want to just thank once again, Sarah, Lori, and Josh for your championing of our communities and your time today. We understand that 2-in-1 is such a critical resource across the U.S., and it's just a great program that's helping us address food insecurity across the country. Before we close, we will kick it back over to Josh and Angela so they can share a few closing thoughts. So Josh, the floor is yours. And by the way, welcome to the United Way family. Congratulations on a first incredible conversation here.
Thank you so much, Candace. And just want to thank Lori and Sarah and Josh Peterson as well for being a part of a really great panel today and for their work on this incredibly important issue. I'm really, really excited at what we're going to be able to accomplish as a network, working with all of you, working with our elected officials, working with all of our partners to help our communities thrive. And I know that a lot of folks are asking and wondering, now what? And we alluded to this a little bit earlier in the call, but wanted to just let you all know that we are very fortunate to have a special guest today who is a former colleague and a friend, Kat Okar. Kat serves as the Special Assistant to the President for Health and Disparities at the White House Domestic Policy Council. Kat, along with several other colleagues, but Kat provides so much leadership, really has played such a key role in addressing hunger from the perch that she's at the White House Domestic Policy Council. Her and her team have also played a key role in the White House Conference on Hunger, Nutrition, and Health. And Kat is going to provide a recap of some of the most helpful ways that you can take action in your communities to be a part of addressing hunger and food insecurity. These action items are directly aligned with the goals of the national strategy on hunger, nutrition, and health that were developed at the White House Conference this past September and that you heard Congressman McGovern reference. So with that, I'm going to turn it over to Kat.
Thanks so much, Josh. It's great to be with you all. And thank you so much for having me. It's such a privilege to be here with you all. Of course, with Senators Braun and Marshall and Congressman Thompson, but also especially Congressman McGovern, who's been such a tremendous champion for the White House Conference and just an inspiration for many of us who work on these issues. And of course, thank you to Josh and Angela and the entire United Way team for having me. Angela and Team United Way, we're still bitter that you stole Josh away from us. But we're getting over it. But we are just know how lucky you are to have him. We miss him already, but no, he will just do tremendous work with you all, and clearly already is. So as Congressman McGovern and others have talked about, there is such a tremendous sense of urgency on these issues. And I know there's so many issues that we are grappling with in society today. And I know those of you in the local United Ways see this every day. But as Angela mentioned, we see hunger and diet-related disease having a cascading effect on children, on families. When a child is hungry, when a parent has a heart attack, that impacts the rest of their life, but also the lives of those around them. And that is really one of the reasons why we are so committed to hosting the White House Conference in September, putting out a strategy that talks about how we as the federal government are going to tackle and end hunger and reduce diet-related disease, but also reduce disparities within them as well. I think it is so critical to think about how we're not just improving society for one population, but for all populations. And certainly there are disparities that persist year after year, and that's really one of our focus areas as well. For those of you who don't know the strategy cover to cover, like me, if you would like to peruse it and kind of get a sense of everything that has happened over the past couple months, I'd encourage you to visit whitehouse.gov/hunger health conference. Again, that's whitehouse.gov/hunger health conference. There you will see the strategy that we put out, which has some of the ideas I'm about to kind of mention to you. Again, the strategy is really the way that the federal government is committing to ending hunger and reducing diet-related disease, but we recognize and really want to make the case more and more that we can't do this alone. The federal government is only one piece of the puzzle, and so we need nonprofits, we need philanthropy, we need the private sector, we need local and state government to all move together and row in the same direction if we are actually going to reach our goals. So Josh asked me to talk a little bit about some of the action steps that you all can take to be part of this. And I know you are already doing so much work, and so I suspect that what I'm about to say may come with an eye roll or two, because I know you are often strapped. You're often strapped for time and resources. And so I'm saying this with a tremendous amount of gratitude and recognition for the work that you all do. But a couple of ideas, and you'll see some of these in the strategy. And I recognize that you probably know many of these. One of the things that we're really trying to encourage is collaboration with local nonprofits, with their state and or local government. So whether it be your state's Medicaid program or your local hospital or even your health insurance plans, can you explore doing something like a produce prescription program? Can you leverage the trust and the reach that you have in your communities to not only perhaps help enroll individuals in SNAP, but if you're already enrolling people in SNAP, can you think about helping to enroll them in WIC and or Medicaid? So if you're focused on one program, Can you consider expanding your reach to other programs or partnering with other entities that do that work? Can you potentially work with your local hospital or your community health center to help screen and educate their patients for hunger and for diet-related disease? We know that providers are hesitant to screen for hunger and diet-related disease when they don't have a place to refer somebody. And so, is there a way that you can not only help them screen, but also help providers know where to refer patients? You just heard, and I know you are very familiar with 211. It's such a tremendous resource. And that seems like somewhat low-hanging fruit to be able to ensure that every healthcare provider, every community health center, every health insurance plan knows about that resource and can leverage it. And at the very least, refer patients there, if not the resources in and of themselves of the local community organizations that are doing work to tackle hunger and diet-related disease. Can you consider partnering with some of your local small businesses? I just heard folks talking about when options are limited for healthy food. There are so many businesses that are popping up that are creating healthier options and need community entities like you all to help expand their reach. Congressman McGovern talked about this in terms of telling your stories that you encounter every day, sharing not only best practices, but stories, not just with each other, but with us. And you have such a tremendous avenue with Angela and Josh and the entire United Way team, who we talk to constantly here at the White House and in the federal government. We want to know what is working, what is not working, and how we can do better. I'd also encourage you to find ways to think about making healthy eating and physical activity a part of your own workplace culture. I think some of us are so focused on how we can help everybody else that we often forget about how we help each other within the workplace that we're in. And so even making those small micro steps a part of your daily life and your workplace culture can make things just a little bit better. Can you work across United Ways of your region, of your state, or even the country to share models, as I mentioned, that are working, that are not working, and to scale those that are? And of course, as Congressman McGovern said as well, how do you better elevate the voices of those with lived experience? We really tried to do that at the conference and continuing to look for ways to make sure that those with lived experience, whether it be hunger, whether it be diet-related disease, whether it's both, to ensure that they're not just being heard, but they're embedded into every policy action we do, every program that you do. Are they informed by that experience? And just lastly, if you're doing innovative programs, can you consider partnering with an academic institution to study the impact of your model, to support communities members getting involved in that research? Again, we need that evidence base if we're going to really make change. So I'll just close by saying thank you again so much for having me. We see the impact you're having. We know you know the urgency of this work. As others have said, thank you for all that you do each and every day to improve people's lives. We see the work you're doing, and we look forward to working with you and the United Way team to achieve those goals. Back to you, Josh.
Thank you so much, Kat, just for laying out these really fantastic ways that our leaders on the ground can be a part of the solution to end hunger in the U.S. by 2030. The things that Kat mentioned as well, just so everybody knows, we're going to make sure to get those out to you, including links to the strategy, including a rundown of the action items that she mentioned and some other resources. So those will be coming your way shortly after today's event. And Kat, just again, huge amount of gratitude to you for being here today, and even more so for your leadership on a tremendously important issue. Thank you. And with that, I'm going to turn it over to Angela to close us out.
Well, thank you, Josh. And Kat, I also just want to echo thanks for your practical considerations for us. We certainly can achieve our goal in 2030, and we appreciate all that you and the White House are doing in this effort. So when it comes to food insecurity, we know that it's an issue impacting more than 13.5 million families each year. Yet collectively, we must address hunger and food insecurity by putting forth robust policy solutions to support our most vulnerable populations and address the intersection of health, education, and workforce development. All of us, from the White House to Chairman Thompson, Senator Braun, and Congressman McGovern, to our 211 leaders that you heard from today, and representatives, to our local volunteers and our partners, we all have a role to play to develop solutions to end hunger by 2030. Together, we can make work to ensure everyone in the U.S. can thrive and have access to healthy meals. Thank you for joining us today and in the years to come on this journey to end hunger. Candace?
Yes, thank you, everyone. All of you, all of our panelists, all of our participants today. So thankful for your collaboration and partnership. Have a wonderful rest of the day, and do be on the lookout for an email that will contain all of the links and information provided today during this session. So take good care. Bye-bye.